Hey guys, I'm in St. John, France, fixing to start the El Camino. Let's go see what Dr. Wyatt has to say.
Hi, I'm Dr. Bill Wyatt again, and today we're going to try to talk about what can we do about airway problems. And I've listened to several other deals, and it's acting like it's a very simple problem, but it is a very complicated thing indeed, and I want to try to cover why it's that complicated. I can give you a little outline. We have one thing, let's say the obstructions that we have to deal with, like there's just right off my top of my head would be adenoid tissue, which has to be taken care of. It can block your airway. Large tonsils can block the airway and do a lot more than that. They force your tongue forward to give you all kind of problems. Then you have enlarged turbinates, these little deals in your sinus up here. You've got 3 of them, and they have a certain function, but they can get oversized, and you have to reduce them in size, and that's another thing that can go wrong. We also can have a deviated septum, or the little tissue that's partly bone and partly cartilage between the 2 sides of your nose. It can be deviated and lean it over to one side and kind of block the deal. Then you can have other enlargements in your area that you'd have to take care of. And then you have a narrow palate, which is the palate up the top of your mouth. Your mouth goes up, and it can go real tall up here and be very narrow and have very little airspace in it, and you have to be able to deal with that. And we have ways of dealing with the palate when it's off like that. Then there are other things, main titles like allergies, and there's all kinds of allergies that people have, and it is a very difficult thing to deal with allergies. But I wanted to explain why mouth breathing is not simple, and you're not going to do 2 or 3 little simple things and start breathing through your nose again. And just for an example, there's no way you can breathe through your mouth without having your tongue in your lower arch. In other words, it's down below. And if you're breathing constantly, your tongue is down low all the time, and the tongue pushes the mandible out, but it doesn't have any pressure on the maxilla up here, so the maxilla doesn't expand like the mandible does. So when the maxilla is not expanded, the mandible will, which is the lower arch, will get out past it, and it'll drop in crossbite. So the upper arch tends to get smaller and fall inside the lower arch. Now, this is bad in that the upper airway is connected to the upper arch, and so your upper airway is small. Now, to get out of that, it's not any simple matter. You're going to have to go in and expand the palate. And we've done that. I've done thousands of cases of palatal expansion over the years, and it works real good. But you've got to know what you're doing when you're going to separate the palate. Now, some people think if they just expand the teeth, that does the job. But the teeth go out like this, and as they go out, the roots go in, and they don't get the palate expanded. So now we've got the palate even more narrow than it was to start with, even though the teeth are out further. But if you look at the teeth, the crowns of them will be angled like this. You've got to know how to bring the roots of the teeth out at the same time. Now, if you do this, we can expand the airway, the air channel. Like you start out with a palate, something like this, the airway is restricted. As you expand it, a lot of times the floor of the mouth, the roof of the mouth drops down, and this airway might have twice as much space in it as this airway did right here. Now, if you get the airway so big that you can get some allergies and swell the tissue up, and you still don't block it off. So I've expanded kids' palate and expanded the roots and got them way out there, and they had a little child that had lung trouble because he was sucking all this crud out of the air into his lungs. And there's a lot of junk in the air. So it would pay us, not to go in areas that is really, the air is so filthy that you can't hardly breathe the stuff. You need to wear a mask of some type or another to do that. So the simple thing is, here's a mouth breather who spreads the mandible out, and he can't help but do that. Now, frequently kids who breathe through their mouths are tongue thrusters. They push their tongue out when they swallow, and they don't bite together when they swallow. Now, if you think this is just a simple thing, it's not. Most people watching this can't swallow without biting their teeth together if you're grown or any teenager or anything else like that. But a mouth breather and a tongue thruster can swallow without biting their teeth together. And a thumb sucker, somebody, if you're sucking on your thumb or your finger or your lips, whatever you suck on, you don't bite your teeth together either. Now, just listen for a minute. You swallow somewhere around 2,000 times a day. I haven't counted them, but they got little machine deals they can put on your jaws, and they can tell you exactly how many times you swallow. All right, every time you swallow, just go ahead and swallow yourself now. You swallow, you bite your teeth together, and you press together with a certain amount of force. You press together with a certain amount of force. All right, if you do that 2,000 times a day, that's a 24-hour period, your teeth resist several tons of force, even if you just bite with a pound or two of force when you swallow. Your teeth resist a few tons of force every day, and that tells your teeth they've come in the mouth far enough. When they get enough force in there, they stop erupting into your mouth. Now, a normal mouth, you close your teeth together, and this space between your chin and the bottom of your nose should be the same as the space from the bottom of your nose to right across your eyebrows, and then from there up above you've got another third of the face. So the face can be divided into thirds like that. And if you swallow improperly and don't bite your teeth together, your teeth think they haven't come in the mouth far enough. So they don't grow bigger, but they drift together. And if they drift together just a millimeter or two back here in the back of your mouth, that increases the front of your mouth by 3 or 4 or 5 millimeters. And you take somebody and give them about a ½ inch extra lower third length in here, and the mouth goes down like this. And after a while, they'll get so bad that they just look terrible. And not only this is happening, but you're squeezing the palate together up above, and you're reducing your airway, and so you end up with a facial structure that is really screwed up from nothing but mouth breathing. Now, there's no simple, easy way to overcome this type of thing. You have to really go at it hook, line, and sinker to do it properly. and getting an ENT guy to go in there and take your tonsils and your adenoids and things out is sometimes difficult to do. I finally, in the practice, found several ENT people that understood what was happening in here and would take the adenoids and the tonsils out, or reduce the turbinates or straighten the septum or whatever was wrong in the airway. You got to get somebody an airway. I would send them in, some people, they'll spray their nose out, shrink everything up, say, well, you can breathe all right, but they've got allergies and they can't get rid of the allergies. So I can't get rid of mine. You'd have to move out of the country sometimes to do it. So it gets quite complicated. Maybe you can see that correcting mouth breathing back to nose breathing is very difficult to do. But I have taken adult people that were chronic mouth breathers and tongue thrusters, and all this is mixed together, and they'd have a long lower third of the face, and if they close their lips together, like Carol Burnett or somebody like that, they look bad. If you have a long lower third of the face, the best way to mask it is to smile all the time, because you can't tell. But when they close together, they look like this, They look terrible, really. So, but if those people smile, now I have taken older people, separated their palate, moved the roots of their teeth apart, got a better airway, and those people would tell me they could breathe better almost immediately. I just a couple of weeks into the palatal separation, and we learned to do palatal separation on people in their 30s, which is something wasn't done prior to that. And when I'd get their palate separated, they immediately said they could breathe better, and they get to where they could breathe properly, and then close their teeth together. Or maybe we took teeth out to close a full face and bring it back and reduce the resistance in there, and then over a period of time, if they're swallowing properly now all the time and pressed on their teeth, they will go back up. So I've had people, I check them 20 years later and they look better. Their facial structure was looking better. So maybe this will convince you or let you know that you're not going out here and taking any 3 or 4 little simple steps or whatever. I mean, if you think you're going to correct mouth breathing and change it to nose breathing in an easy manner, I'm sorry to tell you, but you're mistaken, and you're going to have to really look into the cause that made it get that way to start with.